In 2010, Massachusetts General Hospital came under fire after a patient died on the cardiac unit. His heart rate fell dangerously low. This sounded many alarms at the nurses' station. However, the nurses on duty don't recall hearing any. After about 20 minutes, a nurse did enter the room to find the patient pulseless and unresponsive, sort of like this guy. The nurses were not aware that the patient was in distress until it was too late. Investigators concluded that alarm fatigue had a huge part in this patient's death due to the constant beeping on the unit.
Alarm fatigue is a phenomenon where nurses and other healthcare workers become desensitized to many alarms. They either don't notice them or ignore them altogether. Alarm fatigue happens in a lot of the intensive care settings where a lot of the patients are dependent on a lot of monitors and machines. These machines include the IV pump or the kangaroo pump or something like a ventilator, all which above have many alarms. When healthcare workers are constantly exposed to these alarms, they eventually become background noise. This is a large safety concern as nurses and other healthcare providers may not be responding to these alarms. The constant alarms are bothersome, so some nurses may even permanently disable them. Life-threatening outcomes can unfortunately occur from this situation. The FDA reported from 2005 to 2008 that over 560 deaths occurred from alarm fatigue.
There are many factors that contribute to alarm fatigue. One is the sheer amount of alarms. One hospital reported 350 alarms per patient per day. Another hospital reported 1 million alarms per week. One reason there are so many alarms is because a lot of them are inaccurate. Between 72 and 99% of alarms are false. Many nurses assume that the alarm is sounding because a patient is coughing, moving, or there is a loose wire.
Nurses should be rounding and assessing patients hourly and make sure to personalize equipment specific to patients. Make sure the pulse source is accurately placed so that it can read correctly. And of course, all nurses should be properly trained to use all equipment.
Nurses should discuss with the providers the thresholds and when they are too tight. Another intervention to do is to decrease the heart rate and blood pressure threshold alarms during the nighttime while the patients are sleeping, because these tend to decrease at night. One study found that when the pulse ox alarm is set from 90% to 88%, there's a 45% decrease in the alarm sounding.